Introduction to Saam Acupuncture, Korean 4-needle technique. A discussion with Dr. Choo, author of the Saam Acupuncture manuscript. I'm here today with Dr. Choo. Dr. Choo is a professor from Korea at Korea's prestigious Kyunghee University. He's also a professor at Saam University of Oriental Medicine here in Los Angeles, California. He's currently the owner as they go through their restructuring and reorganization. Dr. Choo has brought to us his translation of Saam acupuncture. This is a Korean acupuncture technique that is used widespread in Korea. Dr. Choo, this is the first translation into English of Saam acupuncture. So thanks to Dr. Choo, we have a new Korean medicine. And today we're going to talk about Saam acupuncture. I'm going to ask Dr. Choo a couple questions, and we will begin. Welcome, Dr. Choo.
Thank you very much.
Can you tell us a little bit about Saam acupuncture, its history, and its place in the field of acupuncture in Korea?
Yeah, it's a Saam acupuncture is actually established by a Korean monk. Is not identified well because the highest monk they would like to reveal their real identity, like his name and his ages. So we don't know exactly who he is. From the review of the reference of his clinical record, we estimate he lived at 400 years ago, Joseon dynasty in Korea. And most distinguishes the difference from the West, traditional Chinese medicine. Now is most people learned in America is the concept of the meridians in acupuncture. So the name of the each meridian has two factors. One is the yang, 3-in, like Tai-in, Xiao-in, and Jue-in, Xiao-yang, and Yang-ming, and Tai-yang. And then plus the organ, 5 organ, and 5 Chang, 6 Fu. And two factors has meanings. The first part is from the 6 Qi. Second part, the 5 Chang, 6 Qi, from the 5 elements. The two factors combined has a real meaning of the meridians. That is the big difference of the concept of the meridians. Saam acupuncture with and the traditional Chinese medicine studied in the United States. And what is the next question?
The next one. Now, Dr. Choo uses Saam acupuncture predominantly in his technique. Can you describe the actual technique, and is there a difference or a certain power about Saam acupuncture as opposed to traditional acupuncture?
Yeah, it's traditional acupuncture is you use the body, trunk, and 4 extremities. But the Saam acupuncture is mostly used for extremities, especially the 5th point. And on the recently in the anatomy, the homunculus reveals the hand and the foot part is a big area in motor and the sensory area. So when you insert the needle 4 extremities, is more activated in the brain area. Also in Neijing says the four extremities is the root or origin. The trunk and the head are the branch or branches. So that's why when the treatment of the problems of our illness, we should treat the root or origins of the problems.
Okay. Can you tell us a little bit about Saam and how widespread it's used in Korea? Is this a popular technique used in Korea?
Yeah, medicine? It's a Korean acupuncturist. The Oriental medical doctors, they know Saam. I think it's 100% they know about the Saam acupuncture. Among them, some research says over 50% of the Oriental medical doctors they are using the Saam acupuncture method right now. Okay. Also, the Saam acupuncture is very just like spreading to the world. I'm gonna give the lecture to the Europe next May in Switzerland and German. Also next March I'm gonna introduce to the Saam acupuncture to the Colombia in Bogota. So also the east part. Actually, so I gave the big seminar to the acupuncturist this
2 weeks ago.
Yeah, 2 weeks
October.
ago. October 26th and 5th and 6th, and in the LA Convention Centers, the many acupuncturists came from New Mexico and New York and San Diego. So I think it's in the United States also. There's so many doctors, they already knows about the Saam acupuncture. Getting spread out the world.
Again, I'd like to thank you, Dr. Choo, for talking about Saam acupuncture. This is the manuscript, and as of now, there's no other literature in English on Saam acupuncture. If anybody wants to get the transcript, your book, where can they get it from, Dr. Choo?
Call me.
Okay.